In this video, we are going to cover fentanyl as a medicinal substance. Fentanyl was first developed in the 1960s as potent opioid anesthetic and analgesic. It should be added that fentanyl is up to 100 times more powerful than morphine and up to 50 times more powerful than heroin. Pharmacodynamics. Fentanyl produces strong analgesia through its activation of opioid receptors in the central nervous system. Indeed, the activation of the opioid receptors by fentanyl leads to the decrease of the release of the excitatory neurotransmitters that are glutamate, and this leads to the decrease of the response of the postsynaptic neuron. Opioid receptors. Opioid receptors are expressed throughout the central nervous system. To date, there are 4 different types of opioid receptors that are the mu receptor, delta receptor, kappa receptor, and like-1 receptor. Fentanyl binds especially to mu receptors. Adverse effects. Fentanyl has avoiding effects and thus high abuse potential. Its repeated use leads to the development of tolerance and strong drug dependence. Additionally, other side effects were reported when using fentanyl. For example, hypotension, sedation, nausea, potential for addiction, and respiratory depression. Toxicity. Severe respiratory depression can occur and result in death from acute opioid poisoning. How to overcome this overdose? It is possible to overcome this overdose by the administration of the opioid naloxone, which is an antagonist that reverses the action of the opioids. Naloxone is a competitive inhibitor of the mu receptor where the fentanyl binds to. So, by blocking this receptor, the effect of fentanyl is suppressed. Hence, we have an antagonist effect from the naloxone. Indication and forms. Fentanyl is indicated for short-term analgesia as it is administered as intravenous or intramuscular injection, or it is indicated for the management of breakthrough pain in cancer patients. Of course, the patients must be tolerant to opioid. When it is indicated for the management of breakthrough pain, it is administered as tablets, buccal tablets, transdermal systems, or nasal sprays. Summary. Fentanyl is more powerful than morphine and heroin. Fentanyl binds mainly to mu-opioid receptors of the central nervous system. Fentanyl's repeated use produces a strong tolerance. Severe respiratory depression can occur and result in death from acute opioid poisoning. Naloxone is used to reverse the coma of opioid overdose. Lastly, fentanyl is indicated either in analgesia or in management of breakthrough pain in cancer patients.